There is nothing more precious for a family than the birth of a child. For some parents, a healthy baby sadly does not result into a healthy mom. After delivery, complications crop in and in some cases leads to death. Our focus today is on maternal mortality. You're welcome to the program Your Health, showing on NTA Channel 5 Abuja, the Unity Station. I am Salamat Ozioma Lukman. Now let's take this report on maternal mortality and I'll be right back.
The rate of maternal mortality in Nigeria is reported to be on a high rate. According to the World Health Organization, 814 women die as a result of pregnancy per 100,000 live births. Maternal mortality refers to any loss of a woman's life resulting from pregnancy or death within 42 days after childbirth. The issue of illiteracy contributes to the high rate of mortality. Some women prefer to go to native or community personnel to help in the delivery of their child. This might lead to death or complications. Maternal mortality can be reduced by educating women on the need to visit the hospital where facilities are ready and available if complication occurs.
We now have an idea of what maternal mortality is. It is that death that occurs during pregnancy or within 42 days after delivery. Here is our doctor as he enlightens us more on maternal mortality.
When it has to do with maternal mortality, it is an alarming situation here in Nigeria, compared to what is obtainable in Western world. That in this side of the world where we all acknowledge that childbearing and delivery is supposed to be a blessing, a joy to the homes. But today it discovered that many people in the course of that particular journey ended up not being in position to go back with their baby. And it's a very tragic situation for a woman to die during childbirth. So when it has to do with the definition, maternal mortality could be defined as death of a mother or a pregnant mother within the time of that pregnancy or even up to 6 weeks after the delivery or that particular baby. So anything that happened to the woman within that time and also even after delivery, because a lot of other things can still happen after the delivery. So all this should be able to be well covered to be able to know the actual outcome of that very pregnancy. And there are a lot of things that could cause issue of maternal mortality. And number one in our environment could be described as misconceptions and some of the mindset we have in this world that somebody should not be, somebody will want to deliver, doctor will advise this person, you need to deliver by cesarean section. He says, it's not my portion. I will deliver like a Hebrew woman. I will do all that. So a lot of women with already existing complication will end up dying on what otherwise could be described as being preventable. So the issue that has to do with some of our women rejecting a professional advice to them, could be in position to, like a woman that have a contracted pelvis, that's when the birth canal is small compared to the head of the baby. Such a person can stay in the course of trying to push and push. It may rupture the womb and may bleed and bleed to death. So many of them have lost their womb to that. Some of them have also died in the course of the process. There is also what is called placenta previa. Placenta previa is when the placenta is actually located down. Sometimes it can cause a lot of bleeding. But when that placenta has what is called placenta accreta, or placenta pacreta, this particular type of placenta, instead of staying inside the body of the woman's womb, it will now grow inside the muscles of the womb. Sometimes can go outside. So by so doing, to remove the placenta may become difficult. And if this is not done in a professional environment, where even hysterectomy, removal of the womb, can save the life of that woman can bleed to death. But when it has to do with maternal mortality, the commonest cause of the death is what is called postpartum hemorrhage. When a woman delivers, but they couldn't control the bleeding. Sometimes the womb may not be able to contract at that point. It's usually a big problem, all right? And another one also is when they have to do what is called puerperal sepsis. When a woman delivered and infection goes in, sometimes that infection can be so terrible and that woman can also go from there. So issue of bleeding during delivery and also the issue of infection after delivery had been found to be commonest cause of maternal death during that time. And looking at other factors also, there's what is called preeclampsia. I will be in position to talk a little more about that. So the preeclampsia is the hypertension induced, pregnancy-induced hypertension, but most striking is that if there be a protein in the urine, sometimes can be associated with less swelling, but when there be a protein in the urine, you call it preeclampsia. That time the BP will go up. Any woman that is pregnant and suddenly start having high BP and also having protein in the urine, that woman is in a danger list that need to be professionally managed. Otherwise, that woman can convulse on what is called eclampsia. And most time, once they convulse once, some of them pass out like that. Some may convulse twice and go. So it becomes imperative that when it has to do with the issue of preeclampsia, hypertension, pregnancy-induced hypertension with a protein, that it is expedient that such person should not be managed outside the hospital. It should be managed in a hospital where you have the facility to be able to counter such a situation. And that's why sometimes doctor can advise for preterm delivery, that this baby has to come out, because it has been shown that when the baby comes out, the blood pressure also gradually goes down, So this and many more could be in position to make a woman, and in our environment, a very, very common unfortunate happening. In the aspect that has to do with the prevention, there's something very imperative we need to look into, and that has to do with pregnancy counseling. In this side of the world, people hardly go for counseling for pregnancy, not just a chakpa, the person don't get pregnant and that's the money, it don't become. No, in a number of occasions, there should be what is called pregnancy counseling, like a woman that has suffered issue of miscarriage in the time past, or a woman that has suffered a preeclampsia that I talked about, which is a pregnancy-induced hypertension with the protein also in the urine. This kind of people, or somebody who is diabetic, the diabetic person should not just get pregnant. It should be able to be counseled, because in diabetes, for instance, there's what is called congenital abnormality associated with it, what is called neural tube defect, where a baby can come up with something at the back called spinal bifida. So that kind of abnormality can be avoided if someone is already a known diabetic and want to get pregnant. It should be able to be first counseled. In fact, as a matter of fact, it's recommended that for the first 3 months before pregnancy begins, that they should be on high dose folic acid, to be able to prevent such situation. And now, looking at the issue of preeclampsia, which most women, when it is not properly managed, once the BP goes up and the person fits, called eclampsia, the person can die. So when there be a such that are happening, this woman should be counseled first. And what is the counseling segment of it? That's what is called NICE guideline. It's a UK evidence-based guideline which helps to manage a woman that have suffered a preeclampsia before. And the criteria states this way: it group the women into major and the moderate risk. And the first major risk is that, is this woman had preeclampsia in the previous pregnancy before? Is this any woman having renal kidney related problem? Is this woman having any autoimmune disease? Or is this woman a chronic hypertensive, or having what is called systemic lupus erythematosus, SLE? So they group that class of women in the major risk. Then they go further to make the one of moderate risk factors, which includes a family history of preeclampsia, that this woman that's in a family, somebody has suffered that, or that this woman is obese, or this is a primary gravid, that this is the person is getting pregnant for the first time. And also extreme age, those ones that maybe start having their pregnancy above 35 years, and also less than 20 years, or this very woman having what is called inter-pregnancy interval being so long, assuming that this person had gotten pregnant before, maybe 10 years after is getting another pregnant. You also call it a moderate risk, factor, and multiple pregnancies and all that. So all these things are all grouped under moderate risk. And NICE guideline says, if any woman has one major risk or two moderate risk noted in that woman, that particular woman should start vasopressin one daily, or this aspirin. In United States you have about 150 milligram, but here we have 75 milligram. But that woman should start it from the 12th week of the pregnancy till the delivery. All right, that has been able just to help enormously when it has to do with the prevention of such. Now, coming to the aspect that has to do with bleeding, that brings us to the fact that if a woman is pregnant, you do not need to be in position of being pregnant and you say, I don't want to register in a good hospital. No, I appreciate also those that are doing what is called traditional birth attendant, having a maternity. I appreciate everybody in that regard, but most important is that while you are running your maternity or your traditional birth attendant, relate with a hospital that should be able to manage complications on these women if it arises. And in a situation, a woman you have been registered with, you having BP or high, please don't keep that woman. That woman will die in your hand. Take that woman to the hospital where it should be properly followed, and where there is intervention as quickly as possible. That should also be done. And in a situation where the baby size is big, that's why it's important to do ultrasound. If you do a scan and the doctor do pelvic examination and discover that this woman has contracted pelvis, the bed canal is narrowed, you don't need to go and tell the woman push, you must deliver like a Hebrew woman. No, you want to kill that woman. You want to make that her joy to be cut short, because some of them may rupture their womb and off they go. And also, it's important that if you have a do ultrasound and you discover that there's a woman that has what they call major degree placenta previa. Placenta previa is a placenta usually grow at the fundus, at the back, not from that mouth of the cervix where baby comes out. So if the placenta now grow on the lower side and is covering everywhere, asking that woman to push, she may bleed to death in your presence. So these are very, very important things you should be in position to do, and connect with a hospital. And if there be what I earlier mentioned, what is called placenta accreta, this very accreta, that the placenta, usually in the delivery, you deliver the baby, you call it second stage, and then you deliver the placenta, all right? But usually the placenta can follow you normal and just come out. But in some occasion, it may not do like that. In the case of that placenta accreta, it may grow inside. So sometimes you see the doctor putting hand to manipulate it in pieces, and it bleeds a lot. So when that woman is bleeding, there should be a backup of blood. There should be a backup of professional support where necessary, so that the life of that woman will be saved. These are all preventable events. And also, when it has to do with issue of delivery is something that the body of the woman is open. Pregnancy induces what is called reduced immunity. It compromises the immunity of that very woman by reason of hemodilution and all that. So by reducing the immunity, that woman has a high chance of getting infected. So on that accord, it's important that where you deliver this woman, if you're outside a hospital, good hospital setting, let it be a clean environment. Maintain sterile and aseptic procedures in the course of your delivering that very woman. Because if you have infection that time, it could be very unfortunate, because the whole body is open. The infection may grow and cause even what is called DIC, and the woman will bleed without control. So there are many things that could happen in the course of this. A very sensitive thing. Be that as it may, a collaboration. Do not go and say, no, I don't want to go to hospital. The hospital is expensive. That's why I'm managing myself somewhere. God has made it possible also that the government establishments are there, who in most cases can even get this thing done for you. Okay, but register with a professional setting, be it a teaching hospital or a medical center, where a doctor can be reached when the unfortunate want to happen. Let me first of all put it in terms of location. Ignorance is not a respecter of title, not a respecter of location. If somebody that's supposed to go and do cesarean section and is being told that no, if you go to hospital, it's not your portion, don't go to hospital, don't do that, the person will stay there irrespective of the location. You understand me? So I don't want us to attribute it. In the rural community, we admit the fact that good hospitals may not be there. And that's why I also recommending and advocating that even in that rural community, get an attachment. In a situation, saving one life is an amazing thing for you. All right, connect with a doctor, even if it is anywhere in town, that should be able to help out. Now, looking at the aspect of the can it be a carelessness of the doctor and all that, it's a very broad subject to discuss, because a lot of things could also go wrong in the course of it, which unfortunate, as I keep telling my colleagues, when you are attending to this very patient, carry them along. Because when you don't carry a patient along, when something goes wrong, it's just talking the way, and issue of somebody, a woman dying during delivery, it's a trauma. It's just like you're expecting joy. All of a sudden they give you a good news. Nobody will accept such, So the aspect that has to do with expertise in terms of negligence and all that, I think it is a problem of communication gap. Because if you are doing something and say this is what the challenge is, I think it will go a long way to eliminate such development. Yeah, number one thing I want to put up as a very, very striking word is that to every woman going into pregnancy, there's something very important you should know, that it is your life that is at stake when it has to do with those challenges. And your presence in your family may be the only reason why your children will not become slaves in their father's house. So it is important that when doctor gives you an advice, stick on the professional advice of it, not what somebody else has said. That occasion somebody will just be there and say that there's somebody praying for me. It's good to pray, but it's also in this very situation for you to have follow professional advice when it has to do with your delivery. And no man will be in position to be delightful to see the wife. If they, because of issue of money, be open to that. Some men, because of issue of money, they don't want to spend money, they will ask the woman to continue. Maybe a preeclampsia that's about to kill the woman, he say no, continue, you will not go for cesarean section. No, always be in position to seek to the advice of your doctor. You know, a number of occasions some people say a doctor just want to do cesarean section. No, listen to me, it's a function of trust, it's a function of relationship. If a situation where you feel you get to a doctor and you feel that just because the doctor want money, that's why I want to do cesarean section, nobody is forcing you to be there. Do you understand what I mean? So it shouldn't use the issue of money. The doctor, that's because the doctor want to do cesarean section. If you have trusted the doctor to do something for you, also trust his own professional opinion. Otherwise, look for someone that you feel that is what he's telling you is also the truth, instead of using that as a reason why we should be losing our women in something that is preventable.
So true there. It is your life that is at stake. Think about yourself and the future of your children. Learn more during pregnancy, especially from health experts, to avoid complications. Let's take some health tips that will help you during pregnancy.
It is important to know and apply various tips to maintain a good maternal health. Some of these tips are: get early prenatal care. Attend your antenatal visits always. This will help detect medical conditions that may lead to complications. Women should have access to skilled care before, during, and after they give birth. Get the right information on how to stay healthy during and after pregnancy. Eat vegetable and calcium-rich foods. Do not smoke and avoid secondhand smoke. Avoid alcohol. Get enough sleep. Avoid harsh or toxic cleaners. Avoid lifting heavy objects. Drink plenty of fluids. Exercise regularly, but don't overdo it. Exercise helps increase vaginal delivery and manage common discomforts of pregnancy.
Get early prenatal care, and of course, avoid lifting heavy objects when pregnant. It could lead to miscarriage. Moving on to our question and answer segment. You're welcome to our interactive segment. You can be part of this show by sending in your questions and comments to the number displaying on your screen. Our first question is coming from Mary. She's asking, does bleeding during pregnancy always mean that there is a problem? Well, bleeding during pregnancy has many causes. Some are serious and others are not. We always advise you to contact your doctor so that proper evaluation can be done. Our next question is from Jacob. He's asking, how long should one warm up in a physical training session? Do not embark on physical training session without seeking the advice of a physical trainer. You might injure yourself in the process. For a start, it is always advisable you start gradually depending on the kind of exercise you're doing. This is all we can take on our question and answer segment. This is where we call it a wrap on today's episode. You can always watch a repeat of our previous episode on our social media platform. Our focus today was on maternal mortality. Always have your babies in a well-equipped facility and get the right information from health experts. Until we come your way, same time, same day, same station next week, do have a wonderful day ahead.